Today's lesson is based off of foodborne pathogens. These are some of the common foodborne pathogens that the U.S. Public Health Service has identified as microorganisms as being the biggest culprits of foodborne illness today, either because of the severity of the sickness or the number of cases of illness that cause. So beware of these pathogens and fight back. Today's objectives, we will be discussing the importance of foodborne pathogens, the different classes of foodborne pathogens, and methods of controlling foodborne pathogens. In this section, we will be going through the bacterial causes of foodborne illness. First up is Clostridium botulinum. Foodborne botulism can happen due to contaminated food sources such as homemade foods that have been improperly canned, preserved, or fermented. Though uncommon, store-bought foods also can be contaminated with botulinum toxin. Botulism is a rare but serious illness caused by toxin that attacks the body's nerves. Some of the symptoms involved with botulism starts with weakness of the muscle that controls the eye, mouth, throat, and face. The weakness may spread to the neck, arms, torso, and legs. Botulism also can weaken the muscles involved in breathing, which can lead to difficulty and/or, at worst, death. Foodborne botulism is rare but serious illness caused by eating foods that are contaminated with the disease-causing toxin. You cannot see, smell, or taste botulinum toxin, but even taking a small taste of food containing this toxin can be deadly. Home canned vegetables are the most common cause of botulism outbreaks in the United States. From 1996 to 2014, there were 210 outbreaks of foodborne botulism reported to the CDC. Of the 145 outbreaks that were caused by home-prepared foods, 43 outbreaks, or 30%, were from home-canned vegetables. These outbreaks often occur because home canners do not follow canning instructions, did not use pressure canners, or ignored signs of food spoilage, or they did not know they could get botulism from improperly preserved canning vegetables. Low-acid foods have a pH greater than 4.6. Some examples are asparagus, green beans, beets, corn, and potatoes. Next up is Campylobacter. This is the most common bacterial cause of diarrhea illness in the United States, according to the Foodborne Diseases Active Surveillance Network. This indicates about 20 cases are diagnosed every year for every 100,000 people. Campylobacter causes an estimated 1.5 million illnesses each year in the United States. People can get Campylobacter infection by eating raw or undercooked poultry or eating something that touched it. They can also get it from eating other foods, including seafood, meat, and produce by contact with animals, and by drinking untreated water. Although people with Campylobacter infection usually recover on their own, some need antibiotic treatment. How do people get infected with Campylobacter bacteria? It takes very few Campylobacteria to make someone sick. A single drop of juice from raw chicken can contain enough bacteria to infect somebody. Most Campylobacter infections are probably acquired by eating raw and undercooked poultry or something that has touched it. People can get infected with the cutting board that has been used to cut and prepare raw chicken, isn't washed before it is used to prepare food that are served raw or lightly cooked, such as salad or fruit. People can also get infected through contact with dog or cat feces. Very rarely, people have become infected through a transfusion of contaminated blood. Treatment: most people recover from Campylobacter infection without antibiotic treatment. Patients should drink extra fluids as long as diarrhea lasts. Our third foodborne pathogen is E. coli. So symptoms of E. coli are severe bloody diarrhea and abdominal cramps. Sometimes the infection causes non-bloody diarrhea or no symptoms. Usually little or no fever is present, and the illness resolves itself within 5 to 10 days. In some persons, particularly children under the age of 5 and the elderly, the infection can also cause a complication called hemolytic uremic syndrome, HUS, in which the red blood cells are destroyed and the kidneys fail. About 2 to 7% of infections lead to this complication. In the United States, hemolytic uremic syndrome is the principal cause of acute kidney failure in children. In most cases of hemolytic uremic syndrome are caused by E. coli. The onset could take 2 to 5 days after eating, and some of the sources of this foodborne illness is rare but also very dangerous for this type of E. coli. This organism can be found in a number of small cattle farms and can live in the intestines of healthy cattle. Meat can become contaminated during slaughter, and organisms can thoroughly mix into the beef when it is ground. Bacteria present on the cow's udders or the equipment may get into the raw milk. Main food vehicles are inadequately cooked meat, particularly ground beef, sprouts, lettuce, salami, and unpasteurized milk and/or juice. Contact with these foods can cross-contaminate surfaces on other foods. Individuals can also become infected by swimming in or drinking sewage-contaminated water or bacteria present in stools of infected persons, which can be transferred through deficient hygiene and hand-washing practices. This is particularly likely among toddlers who are not toilet trained. Family members and playmates of these children are at high risk of becoming infected. Young children typically shed the organism in their feces for a week or two after the illness resolves. Fourth up is listeria. The symptoms of listeria would be fever, headache, nausea, vomiting, and muscle aches. In pregnant women, can cause fetal and/or infant death. Primarily affects pregnant women and their fetuses, newborns, and elderly people with cancer and those impaired immune systems. The onset could last from 7 to 30 days after eating, but most symptoms have been reported 48 to 72 hours after consumption of contaminated food. Some of the sources of this foodborne illness would be soft cheese, unpasteurized milk, ready-to-eat processed meat, such as hot dogs and deli meats, cooked seafood and shellfish products, fresh fruit and vegetables, and prepared stored deli salads. Compared to other microorganisms, listeria is relatively resistant to heat, salt, and acidity. It can also grow at refrigeration temperatures, so be careful. Shigella. Shigella has caused an estimated of 448,000 cases of diarrhea illnesses per year. Poor hygiene causes Shigella to be easily passed from person to person and infected individuals to food items. Some of the symptoms involve abdominal cramps, diarrhea, fever, sometimes vomiting, and blood, pus, or mucus in the stool. Onset could be 1 to 7 days after eating, and some of the sources of this foodborne illness of Shigella are found in stool of human infected with diarrheal illness. Food becomes contaminated when a human carrier does not wash their hands and then handles liquid or food that is not thoroughly cooked afterwards. Organisms multiply when contaminated food is left at room temperature. Commonly implicated food vehicles are milk and dairy products, poultry, and potato salad. So be careful. Salmonella. Salmonella is the most common bacterial cause of diarrhea in the United States and the most common cause of foodborne deaths. This foodborne illness is responsible for 1.4 million cases of foodborne illness a year. The symptoms include diarrhea, fever, abdominal cramps, and vomiting. The onset is generally 8 to 12 hours after eating something contaminated with salmonella. The sources of this foodborne illness are present in human and animal digestive systems and can contaminate food or water. Raw meats, poultry, eggs, milk, and other dairy products such as shrimp, frog legs, yeast, coconut, pasta, and chocolate are most frequently involved. Children under the age of 5 are the most frequently infected, and adults over 65 manifest this disease most severely. And finally, Staphylococcus aureus is a bacterium that produces a toxin that causes vomiting shortly after being ingested. Staphylococcus is also referred to as staph. The sources of this are because of cooked foods high in protein, such as cooked hams, salads, bakery products, and dairy products that are held too long at room temperature. The symptoms involve diarrhea, vomiting, nausea, abdominal pain, cramps, and prostration. This lasts 24 to 48 hours and is rarely fatal. The onset could generally take 30 minutes up to 8 hours after eating. So approximately 1/4 of people and animals naturally carry staph. They can contaminate food through improper hand washing. When contaminated food is left out too long at room temperature, these toxins are produced. Meats, poultry, eggs, tuna, potato, and macaroni salads, and cream-filled pastries are a good environment for these bacteria to produce toxins. So be sure to make sure you know how to handle hot and cold food. This is the last of the bacterial foodborne illnesses. Next is our viral or virus causes of foodborne illness. Norovirus. Norovirus is the leading viral cause of diarrhea in the United States due to poor hygiene, which causes norovirus to be easily passed from person to person and from infected individuals to food items. Some of the symptoms involve nausea, vomiting, diarrhea, and low-grade fever may also accompany this infection. It could last from 24 to 60 hours. The onset generally occurs 12 to 48 hours after exposure. The source of this foodborne illness would be extremely common of foodborne illness in the leading cause of acute gastroenteritis. However, it is rarely diagnosed because the laboratory test is not widely available. Norowalk, like virus, spreads primarily from one infected person to another. Infected persons can contaminate foods such as salads and sandwiches as they prepare if they had the virus on their hands. Lastly, hepatitis A. This is a liver disease caused by the hepatitis A virus. Hepatitis A can affect anyone. In the United States, hepatitis A can occur in situations ranging from isolated to widespread epidemics cases of disease. The symptoms begin with malaise, appetite loss, nausea, vomiting, and fever. After 3 to 10 days, a patient develops jaundice and darkened urine. Severe cases can even cause liver damage and, at worst, death. The onset would be 1 to 10 days and can last up to 2 months. The sources of foodborne illness for hepatitis A can be spread person to person, or contaminated food during growing, harvesting, processing, handling, or after cooking. Mollusks, such as oysters, clams, mussels, and scallops, and cockles, become carriers when their beds are polluted by untreated sewage. Raw shellfish are especially potent carriers, although cooking does not always kill the virus. Fortunately, there is a vaccine for this disease. This concludes our foodborne illness lesson. For more resources, please go to fightback.org.